All right, welcome to Team on Location, Season 2?
Season 2!
Coming from my garage. Because COVID.
Because COVID.
Can you tell all the people watching real quick what Pat's text was like the day after the release?
Okay, so you guys need some backstory. We love Pat Fryman. Pat Fryman is not on social media. And so this has been so bizarre to release this way of thinking on a virtual platform. We did our big premiere at the Behavior Analyst Leadership Council. And the way that people got is they got a link to watch the documentary. And then we released it on the internet. And you guys might have seen it on Facebook or Instagram or LinkedIn. Pat Fryman is on none of these channels. So we get this text from Pat the next day. And he's so casual about it. He's like, so do people like it?
Yeah.
Like, what do people like? He's like, are people watching?
Facebook, Instagram, everything's blowing up. It was a fantastic day for all of us, I think,
all of
watching the release, hearing what people had to say. Super exciting time to see what was going on. And then I realized, like, man, we should have screenshot and like shared some of these with him, or like at least give him some numbers, right? I'm like, here's what people are saying. Because you just kind of like, what happened, guys? Like, did it work? Because I know you worked hard on it. And I was like, oh yeah, Pat, by the way, overwhelmingly. So just want to share with everyone that he's now in the loop of the impacts it's having. We're sharing him not personal details of things, but I've been looping him in on some of the emails that have been written in, just telling him the context and like the overall message that people are having to say about what we've done. So thank you all for the support. It's been super awesome.
Yeah. And it's really been, I know it's been really heartening to Pat. Frequently the word that he's used to kind of describe how he currently feels is disconnected. And so to be able to look at some of the screenshots of messages, and I know he's just enjoyed it so much, and we're hopeful that we might be able to get out to Boys Town this summer if possible, and we'll kind of have to wait to see what the current conditions are to be able to talk to him about this in person, to be able to talk to Peter and to John and everybody to get their perspective on the impact of this documentary and to be able to really share with them.
I want to share with people that the feedback that you all have been providing or still have time to provide between now and whenever it is we end up back out there. Those are things that can inform like pickup shots or additional things to maybe ask. So I've been telling everybody, the more you submit, the better. The more you comment on the back end of the platform, the better, because we can actually work on patching some of that up if there was anything that we maybe missed or that people really want to know as a result of all this.
You and I have been talking about what to do for season 2 prior to wrapping up This Way of Thinking in Boys Town, because we knew that would be challenging to follow up. I mean, gosh, Pat Fryman's pretty amazing. Boys Town is such a compelling story. Now what?
Right.
And so this was, conversation we had for months and months, and we had decided that we wanted to focus on LA because it's really a compelling location. There's
conveniently close, relatively speaking.
There's so many stories to tell, and that our focus within LA would be on organizations that are doing innovative work in autism services. So we got together with a couple of our colleagues in January. We had a viewing and screening and feedback session for This Way of Thinking, and we're kind of like rolling on all cylinders. So fast forward, really I kind of started thinking that this COVID might be our thing for season 2 was actually the last time I was here, because we had our screening of This Way of Thinking in Reno on Friday, February 28th.
28th, yep. And
I flew here that morning. And I remember I took a nap and I woke up and I saw on my news feed, and I was getting a bunch of text messages that the first novel case of coronavirus had been identified in Santa Clara County. So why does this matter? It's because I am the development consultant for the California Association for Behavior Analysis, and I'm also the past president of the association, and our conference was set to be in Santa Clara the following week. And so I remember I had like a rushed call with a bunch of the board members. We had the screening here that night, and then I flew home the next morning. That was February 29th. I took a 6 a.m. flight back to the Bay Area, and that's the last time I was on a plane.
Yeah.
And I saw both of you guys in Santa Clara 5 days later. And we had thought like, gosh, there's more cases that had emerging. I think by the time we got together in Santa Clara, there was maybe 14 or 15 novel cases. But we're like, you know what? We think we're just going to be able to squeeze in under the wire. We'd had a number of speakers say that they couldn't make it. We had a number of people cancel, but we really thought that we were going to still be able to hold this conference. Get to Santa Clara. It's Wednesday. We are about to, no, Thursday. We're about to open early registration, and the Santa Clara Department of Public Health has this press conference, and they're like, we don't want you guys holding large scale events anymore. And so the Cal Alba conference was canceled 3 hours prior to early registration opening, and then everything continued to go downhill.
Yeah, I came back. I remember posting on social media, just like asking the question of, do we think that this is going to be the trend for the next few months of like other professional development events? And it was pretty split between, I would say, people being a little bit more conservative and like, this probably is the way it's going to go and this is probably the smartest thing to do. And other people saying like, there's no way we could see this affecting a EI or a
this isn't going to be a thing.
Like
people, you know, even in California, we got criticized. Like, you guys are overreacting. You're not paying attention to science. And yet here we are now. So today is March 18th. Or no, it's May 18th.
March.
Oh, God, it's May 18th, 2020. And we're filming in Ryan's garage in Reno, Nevada. I drove here yesterday. This was the first time I had left the Bay Area since February 29th, 2020, because coronavirus has upended everything.
Yeah, as everybody watching knows.
Everything.
And feels.
And so what has become clear to us over the last 8 weeks is the story for On Location Season 2 is the effect that this has had on every facet of behavior analysis. So we're talking practitioners, we're talking staff, we're talking associations, we're talking vendors that work with behavior analysts, we're talking families. And we want to tell these stories. But also what's happened in the last 2 months is this kind of like unprecedented, like open share of resources in behavior analysis. There's also the journal of the Behavior Analyst and Practice Journal, whose editor-in-chief is Jonathan Tarbox, has been able to get behavior analytic articles published in record time for their COVID-19 special edition. And as these things have, you know, kind of started happening in the midst of coronavirus, it's become clear to you and I, like, these are the stories that we want to tell. What's happening to people now? How is this changing our industry? But also, how are we learning in the midst of this, and how are we continuing to be innovative? But we wanted to do this in a safe way.
And so that kind of segues into why we're sitting in the garage.
It's really cold. I'm like, literally, I'm touching a heater. I don't know if you can see this. I'm touching a heater while Ryan is talking to warm up my hands because I'm like bone-chillingly cold right now.
So we've done some research into best practices for filming during this time. You were looking at a number of different places.
Yeah, I've consulted with a number of different people that I know that work in different media outlets in various states, as well as a couple of medical professionals. And part of what makes On Location work, and what we think you guys likely know from watching this way of thinking, is because it's organic, it's authentic, it's real. And I don't think that we could somehow capture what's going on in COVID-19 later and have people kind of reflect on what was going on. What made much more sense, and I think is much more compelling storytelling, is to talk about it now. But we only felt comfortable doing that if we could really ensure maximum safety for all of us. So it's myself, it's Ryan, it's Jarek, who's our director of photography, and also any participants that want to tell their story and be a part of this. And so all of our filming is going to be taking place
outdoors
or in places that are very, very well ventilated.
Yeah.
We also have filming guidelines that we have created, and we'll likely post publicly in some place for people to look at if people have questions in terms of what are the safety precautions that we're taking as a crew? How are we ensuring that really we're having contactless filming? We don't touch any of the participants that we're filming. We just wrapped our first interview today with Carrie Milico. We did not come in any close contact with Carrie. Right now, Ryan and I are sitting, actually it's even further than 6 feet apart because we measured this out yesterday. We have cleaning procedures, we have mask and glove procedures. But what's been really great is in the midst of this, and everyone that we've talked to and really reached out to be able to say, hey, are you interested in telling your story and how this has affected you? people are excited about it.
Yeah,
and
no, they're
wanna
excited, and I think everyone realizes that we're going to do the due diligence, but like they're a part of that as well. So from email one of "Are you interested?" is here's the practices that we're employing during this time, and kind of pitching it. This is going to be safely completed, right?
Yeah. And so Reno is only the first location. And tell us where we're going next.
So we're heading to 2 different locations, as you mentioned. Los Angeles is one of
Yes.
them. There's a slew of different people that are down there and organizations that support even organizations that provide services in different ways that we wanted to be able to head into. The on-location vibe is you feel as if you're there. That's going to be a good, I would say, welcome challenge for Jarek and I to figure out how to still make it visually feel like you're there when we can't do all the things we typically like to do, such as going into a center, showing what things look like. Like that's all going to be different. But we're going to still try to live true to that on-location vibe. And then from there, also the Bay Area. We have a couple different days that we record out there. Same thing, outdoors, super precaution.
And these are all
driven.
places that we can drive to. And these are, so we're in Ryan and Jarek's community. You guys live in Reno. I live in the Bay Area. And then LA is a drivable distance for both of us. And really where we're going to have the bulk of our interviews take place.
I think we can confidently say like we're really tight on our risk mitigation for anybody else that's joining as a part of this. The one thing that we have to be a little bit more honest about, and this was actually part of the editing process, is like Jarek and I do work pretty close within we're breaking those social distancing 6 foot.
Well, sure. And I think we
As
had
a
to talk
result
about
of-
the fact that we had to, I did talk with my family about it. Like coming up here and sure.
Yeah, so I don't know. I think it's worthwhile to note that there's really strict guidelines on a lot of things, and there's some calculated known risks on our side of it, such as Jarek and I operating cameras. Our hands are clean and sanitized, but also it might not be perfect. I don't know. You know what I mean?
Yeah.
I don't know if I'm saying this the way I want to, so we can restate this, but I think we need to be, like the fact, I don't know how to state this, but the fact that we're like driving over state lines and Jarek and I, for example, operating the equipment close next to each other, like there's some known risks that have been, I guess, assessed, agreed upon internally, but also people know that those are happening as a part of this process. So nobody's walking onto set not knowing that something as simple as Jarek and I operating the same cameras is going on, right?
Well, I think what we can say is that we have looked at the big risks, and of course the big risk here is cross-contamination or exposure. And we know from the current data about COVID-19 that when you are, the relative probability that you will become infected through outdoor exposure, especially in light of also social distancing measures and wind factors, et cetera, is very small. But honestly, I think the biggest risk for us as a team is both Jarek and Ryan, you guys have to work in close proximity with each other because that is the nature of filming. And so what we've decided to do as a crew is we're limiting the crew. So it's only Ryan and Jarek that are filming actively. You guys are the only 2 people touching the equipment. I'm not touching the equipment. We don't have any of the equipment touch any of our participants. But that does mean that you guys are going to be in close proximity, and that was a risk that we were willing to take based on each of your own unique health profiles, as well as the health profiles of the people that we reside with.
Yeah, and we were also like, I guess, in this weird decision process of figuring that out before we actually even started this because of wrapping up the editing, the final touches on the first one. So we've kind of gone through this already, these sort of discussions, and we've repeatedly touched on them every 2 to 4 weeks as we kind of gone about them. In addition, there's also some pretty tight guidelines that you wrote up for.
Yes, especially as it relates to health. And so we'll be doing temperature checking. And obviously, if Jarek or Ryan are sick, we're not going to shoot. If I'm sick, we're not going to shoot. If we have a participant who is sick, we're not going to shoot that participant. We're also limiting the number of participants. We're only shooting 1 participant at a time.
Yep.
And we have really clear cleaning protocols of our equipment between participants. But again, we're engaging in contactless shooting procedures regardless. And so even right now, I have a lav a lav
lavalier,
mic,
yeah.
whatever that thing's called. I have a microphone that is worn on my lapel. So
Yep.
does Ryan, and we have procedures for how we can put those lav mics in neutral positions for our participants if they need to wear them. We also have a boom mic that we're using that, again, just kind of sits over participants, and cleaning procedures that we will use after participants have been used microphones. And I also think, we talked about this earlier, we're acknowledging I left my shelter-in-place
Yeah.
orders in the Bay Area to drive here to do this. You guys will be coming to the Bay Area in order to be filming this, but we believe really strongly that these stories need to be told. This is also an opportunity for us to highlight some organizations and associations that are going to need tremendous support from our community. And that's not just financial support. It's people being willing to work with these groups, people being willing, again, to share resources. And we think that that is incredibly important. California Association for Behavior Analysis, as an example, stands to lose almost $1 million as a result of the cancellation of our conference on site, and that is catastrophic. For our association, and we need help and support. And so part of what we'll be doing when we film in the Bay Area is talking to Matt McAleer, who's the executive director of CalABA, and talking to Greg Elsky in LA, who's the current president of CalABA, to really help people understand why is this association so important, not only to behavior analysts in California, but frankly, behavior analysts all over the country. And again, we want these stories to be told in an authentic way. I think that's what made this way of thinking work, because Pat is so real, and all of our participants were so real. And that, for us, outweighed not shooting. The rationale to shoot, and again, to do it in a safe way, was compelling enough from my perspective to move forward.
Yeah, so the other thing that we didn't mention that we've been looking more into as well is just how to go about some of the archival and like access to other things that have already been completed. So if we need to go into things pre-May 18th from day one recording, that we have some flexibility, and we've been learning how to use things that might be on the media, or things that we can maybe source, right, and gather other videos, clips, things like that to kind of tell the backstory.
So what I think you're saying is that we'll be able to tell the story that won't rely on us having to obtain all of the source material ourselves.
Yeah, it's not. Yeah, so I think a big thing here is like we're not walking into a center recording with like to highlight the effects of what's going on right now. And we didn't also, I guess, put ourselves in the midst of the 2 months of chaos that's ensued. We can actually lean on other ways to source, cite, and include those sort of things without putting people at risk. So I know I personally feel like there's some, with the little bit of acknowledgeable risks that we're getting into right now with going across state lines, or like potentially working with people in a social distancing sort of format, we are also doing a lot of things differently from the first one that allows us to tell the story, but through other means.
Right, but still have this like immersive experience, which is the whole purpose of the type of work that we do. And one other thing that I want people to think about, which I think is going to be fun, is this is likely going to, this information and the interviews and content will likely be chunked into more of an episode format, versus a longer form, piece like This Way of Thinking. Just
kind of flip it.
Yeah, as a reference, that took 8 months. It took 8 months to film, plan, shoot, and edit. So this will be great. And what we'll be doing when we look at creating these episodes is also having continuing education content layered either on top of or adjacent to each of the episodes, and we kind of we'll have to figure that out once we start amassing more interviews and just kind of seeing where the story takes us, so to speak.
Yeah, part of this is timely. Like it needs to be information that you get quickly. And so while we're shooting over a 4, 5, 6 week period at least, we're gonna have to start figuring out how to start releasing these things as soon as possible, because it's relevant information that people are talking about now. And there's a timestamp on essentially on it without it expiring or need to be updated, right? So I see this one being much more episodic things that later we can then pull together into something that maybe is representative of this is how COVID-19 affected the service industry of applied behavior analysis. But that picture becomes more apparent and clear as a result of talking with everybody, recording everything, and seeing where things go.
Yeah.
So a little bit of a different model.
Yeah. And here's the most important part. We wouldn't be able to be doing any of this right now if we didn't have the support of everyone watching who has purchased this way of thinking, who has purchased our CE bundle. And I think it's really important to acknowledge that we're so grateful that are patrons of the Daily BA. Those have been supporters of yours for years and years. Thank you.